My name is Tina Rusak, and my presentation is about chronic absenteeism among adolescents. I think all of you know that I am a nurse care coordinator for a school district in north central Massachusetts. My district has 72.5% of students that are high needs. I chose this topic because we've seen a rise in chronic absenteeism after the COVID-19 pandemic. The Healthy People 2030 objective topic area that I'm covering is adolescents, and the objective is to reduce chronic school absence among early adolescents. The target for this objective is to see less than 16.4% of 8th grade students absent 3+ days of school in 1 month. So when you look at the definition of chronic absenteeism is missing 10% of school days or more, or 18 days of school year, or an average of 2 days per month. So the Healthy 2030 objective is consistent with this definition. There's a few statistics on this. This is from the website. In 2017, 20.3% of 8th grade students were absent 3+ days in a month, and that number went up to 32% in 2022 after the COVID-19 pandemic. So this objective is getting worse. A few more statistics to put this problem into perspective. 14.7 million U.S. students were chronically absent in 2021, which was an increase by 8 million when you compare it to pre-COVID-19. In Massachusetts, for last school year, 19.7% of students were chronically absent, with 5.8 of those students missing 20% of school days, or 1 day per week. In my district, a high needs district, 30.2% of students were chronically absent, and 9.2% missed 20% of school days. These next few slides are from the Attendance Works website. Attendance Works is a valuable resource for the educational community, and their focus is on reducing chronic absenteeism. This first slide is showing that chronic absence includes all absences. A lot of times people and providers will think it just includes unexcused, but unexcused is truancy. Chronic absence includes excused, unexcused, and suspensions. All absences are days missed from learning. One strong motivator to reduce chronic absenteeism is to close the equity gap. Students from vulnerable populations, especially from poverty, English learners, and students with disabilities, are 3 to 4 times more likely to experience chronic absence in early ages. Vulnerable children are also much less likely to have the resources they need at home to make up the lost time in learning. They may not have a computer, or if they have a computer, they might not have a Wi-Fi connection. Vulnerable students are also more likely to experience multiple years of chronic absence. And we see, a lot of times frequent absences just become routine for some families. This slide provides a visual representation of what educators have been doing to improve chronic absences. So, basically showing you what educational research is told us about absences. Students have to have their basic needs met first, so that's right up at the top of this model. Curriculum focused on social emotional learning has been shown to improve emotional competence. School climate surveys are given to students and families to provide a measurement for belonging and connectedness. A huge focus for the past few years has been student and family engagement in improving relationships and positive connections at school, ensuring that every student has a trusted adult at school that they feel comfortable approaching on a difficult day. I'm going to start covering some of the literature related to chronic absenteeism and looking at the effects of chronic absenteeism on children, the long-term effects. I'm going to focus more on the health consequences and school nurse interventions to reduce chronic absenteeism for the purpose of this presentation. We know that healthy children learn better. Childhood health problems are leading causes of absenteeism and poor academic outcomes. The effects of chronic absenteeism extend into adulthood, affecting job security, socioeconomic status, and health outcomes, leading to a population that is less educated and less healthy. Chronic absenteeism negatively affects a person's social determinants of health, and we know that it gets worse as children get older. Chronic absence in middle school is a warning sign for not graduating from high school. Root causes, as we've discussed, include acute illness, housing instability, unsafe or violent living conditions, avoidance of bullying or harassment, and school phobias, and family responsibilities. I've had many students that have been chronically tardy to school every day because they are responsible to get a younger sibling on the bus in the morning because the parent has already left for work. Students with chronic health conditions and socioeconomic factors are at risk for poor attendance. School nurses are in a position to take preventative measures by writing healthcare plans in collaboration with medical providers to reduce absenteeism. These are a few studies that are more focused on the school nurse role. School nurses can improve attendance among students with chronic absence, and lower nurse-to-student ratios were associated with increased school-level attendance rates. Chronic student absenteeism is a nurse-sensitive outcome that can provide evidence for the critical role of the school nurse, and health care delivered by school nurses has been associated with improved health status in children with chronic health conditions, fewer absent school days, and improved academic outcomes. My first study critique is a longitudinal cohort study that was done by Santibanez and Guarino, published in 2021 in Educational Researcher. The title was "The Effects of Absenteeism on Academic and Social Emotional Learning Outcomes and Lessons for COVID-19. These researchers wanted to see what educators could expect after the COVID-19 pandemic, because during that time there was a high amount of students that were not engaged in learning during remote learning. They used a convenient sample of California students from the 6 core districts. Core districts are the largest districts in California, who formed a collaborative organization in 2010 to implement new educational standards and train staff. The independent variable in this study was days absent from school, and the dependent variable was test scores and social emotional learning outcomes. So researchers looked at attendance over 2 academic years and then related attendance to test scores and SEL outcomes. The confounders were issues such as suspensions, family issues, and then variance in student ability level. Instruments used was the student fixed effect model, which was a way of analyzing the data and by having each student be their own control. They also used the Smarter Balanced assessments, which was the assessments for math and English, and the core survey for social emotional learning assessment. So this study provides robust data that quantifies absenteeism with test scores, and the authors stated it was really one of the first really great quantitative studies that showed this. So this is definitely a strength for the article. The limitation is that the sample is limited to California students, so might not be generalizable to the entire United States. The results of the study provided evidence that absenteeism affects achievement and social emotional outcomes. Math scores were more impacted than English scores. Students from the following groups were more affected: low income, foster care, homeless, and students with disabilities. SEL outcomes that were most affected were social awareness, self-efficacy, and self-management. Middle school students were affected more than elementary school students, and this is another reason why I included this study, because it speaks to the 2030 objective. The second article that I'm critiquing is a qualitative research study by Rankin, Goldberg, Miller, Kelly, and Ray, published in 2023 in the Journal of School Nursing. It's a qualitative study design that was an exploratory study to identify roles, barriers, and facilitators in addressing chronic absenteeism. So there's a lot of great data that came from this study, so this is why I'm including it. In order to pick the sample, they first took data from the 2014 Healthy Allegheny Team Survey, which is a random digit phone survey of 1,813 high school aged youth in Allegheny County to evaluate relevant factors to health and education, and then they picked their samples with high or low HATS scores. So it's only high school nurses that are included in this study, and there was a population sample size of 23 nurses. So, and they're only from urban and suburban areas, so that's kind of a weakness of the generalizability for the study group. The instrument that was used was the HAT survey and also the interview guide that was developed based on the National Association of School Nurses practice model, and then refined through work and focus groups. The data collection was done by 2 investigators. They performed 30 to 45-minute phone interviews that were audio recorded, and they gave each nurse a $20 gift card for their time. The investigators transcribed the interviews verbatim and then independently coded each transcribed interview and compared the results. The strength of this study is that it identified roles and barriers to plan for future research concerning school nurse interventions that can reduce chronic absenteeism. Limitations I mentioned was limited generalizability, small sample size, but I do have to say the average caseload was 921 students per nurse, and the students in the schools had a absenteeism rate of 16%, so it's similar to national rates. 4 different practice dimensions from the National Association of School Nurses nurse practicing model were identified in the study. So different nurse interventions for each practice dimension are listed here. The roles that addressed chronic absenteeism included direct care, student and family engagement, case management, and collaboration with community providers. For the care coordination dimension, nurses are advocates for students, and they attend school team meetings to manage attendance. Quality improvement, they collect and analyze attendance data, and when they do that, they're able to identify students that are not functioning well by not attending school, who have chronic medical conditions. They're also health educators, and they lead health promotion activities in the school. This study also identified several barriers for nurses in addressing chronic absenteeism. Nurses typically have a lot of non-acute visits, so education to the teachers is key to try to limit the volume of students going into the health office so that nurses can have time to focus on more complex nursing care. High nurse-to-student ratios are an issue, as I've mentioned, and difficulty with collaboration with community providers. There's several reasons for this. Sometimes the parent won't give consent to share information. Some providers won't engage with school nurses, and there are a lot of providers that write blanket excuse notes, or they allow their staff to just fax a note every time the parent calls in without seeing the student in the office. Nurses sometimes are not seen as an expert or not trusted by the educational staff to try to reduce absenteeism. And sometimes they don't have access to the attendance data, or they may not receive those excuse notes, so they're not seeing those coming in from providers, and those absences are being excused. Although, as I mentioned before, they still are calculated into the chronic absenteeism rate. Sometimes there's lack of school nurse training or lack of knowledge when it comes to mental health, or appropriate staffing to refer students to in terms of mental health issues and the need for community resources. There are a lot of research gaps when it comes to school nursing interventions and how they may impact attendance concerns and academic outcomes. Some areas include how direct care for acute and chronic illnesses will improve attendance, involvement in MTSS or attendance school teams, school nurse collaboration with primary care providers. How will these interventions relate to improving attendance over the long term? There's also research gaps in terms of barriers to nursing interventions, nurse-to-student ratios, how that prevents nurses from practicing to the extent of their RN license. Nurses not feeling valued as members of the academic team, and the barriers to collaboration with community providers. This is another attendance work slide. It just shows how we organize our interventions in the educational setting. We currently are working on what's called the MTSS model, or it's called multi-tiered system of supports. So it's a pyramid with a base, which is what we do universally for all students to prevent chronic absenteeism, and that is interventions for both students and families. So that's the base, and the tier 1 is the universal interventions, and then we move up to tier 2, which is interventions for students missing 10 to 19% of school days. So those are usually more simple interventions. And then moving up to tier 3 is the intensive interventions for students that are missing 20% or more of school days. So this slide is giving you an idea of what tier 1 interventions would look like. It's laying the groundwork for good school attendance, building those trusting relationships for nurses. We should especially build those relationships with students and parents of students with chronic health conditions. Nurses can communicate policies and procedures, and this really informs the school community what nursing care looks like and what's possible in the school with one nurse in every school. Nurses provide education, as I've mentioned. They do health screenings to try to identify students that have hearing or vision issues and refer out as needed. School nurses do chronic health conditions management, so focusing on what is needed for our students that have asthma, diabetes, depression, anxiety, seizure disorders, life-threatening allergies, focusing on those and making sure that those students have everything they need at school. And school nurses review their school and district data to provide surveillance to identify students in need of tier 2 or tier 3 interventions. When nurses identify unmet health needs, they perform care coordination to put those health resources into place. And I spoke about this in the previous slide about referring to either in school or outside of school to fill those gaps. A student may need a new or updated health plan or IEP. A lot of times families have gaps in knowledge about their condition that is related to absences. So identifying and providing that education to students and families is important. Tier 2. And then, of course, collaborating with those community providers, because we're working on that circle of support for the student. So the team in the school and outside of the school that's helping to support that student and provide for any health needs that they have. And then any new policies that are needed to manage barriers at the population level. So again, those nurses need to be attending those meetings in order to promote any new policies that are needed by the population. My last slide about recommendations for practice is for Tier 3. This involves continuous case management, and this would only be for a small group of students, and it'd be those students that are absent on average 1 day per week. It's an ongoing process of regular check-ins, monitoring, and writing a plan of care with action items specifically to reduce absences. The nurse will collaborate with the school team and the community health providers, working towards improving that student's attendance. So this picture is a guide from the National Association of School Nurses, and it's really a great model to follow for a school nurse-led case management. Unfortunately, the majority of schools do not have the nurse staffing that is necessary to perform this level of care. In case you haven't noticed, I'm pretty passionate about this topic. Research is still very limited on school nursing impact on chronic absenteeism. So studies should show variances of nurse to student ratios and how a lower nurse to student ratio would increase nursing involvement and attendance and what that impact would be. We need the data to justify school nurse role in reducing chronic absenteeism. And really, we need long-term cohort studies, starting with elementary school students with risk factors for chronic absenteeism. We have a mountain to climb when it comes to improving chronic absenteeism rates among 8th grade students in order to meet this Healthy 2030 goal. In order to improve attendance at the end of middle school, the school community must start interventions in elementary school. Long-term studies are needed to capture this slow progress. I feel that we can move that needle more quickly by increasing staffing levels of school nurses in our schools so they can identify health barriers that prevent students from attending school. Thank you.